Mr Barr, there's a lot of big changes in who's going to turn up at testing centres as a result of National Cabinet's decisions this afternoon. How confident are you that there's going to be enough capacity there now for people who have close contacts or who are symptomatic to be tested quickly?
Laura, there's still going to be pressure, but I think some alleviation of that pressure. The unknown is really case numbers and whether we're going to see further exponential increase in case numbers over the coming weeks. But some pressure has been alleviated and many jurisdictions are doing their utmost to increase their testing capability through a combination of rapid antigen tests and the more traditional PCR testing.
And was the feeling in National Cabinet that there will be enough PCR and rapid antigen tests available at those testing hubs?
Not yet. I think the concern still remains that we're several weeks away from the tens of millions of new tests arriving. So I think we've got a difficult few weeks ahead of us, both in terms of case numbers, hospitalisations, pressure on the health system and still in testing.
Well, the Prime Minister set out, and you've referred to the fact that there'll be free tests for people who are symptomatic and who are close contacts at testing centres, and there'll also be free tests for people with concession cards available through pharmacies. But that doesn't really sort of address the question of people who want to be able to access tests for other purposes, like going to visit an elderly relative. The states and territories signed up to not making tests free universally. Can you just explain from your perspective why that is?
Look, I think at the moment, in the initial period, there is just simply a supply challenge that there aren't enough tests. So it doesn't really matter what the price is, whether they're free or otherwise, if there aren't tests to provide. So what we achieved today was more free tests available to many millions of vulnerable and low-income Australians. And we've also got, and the Prime Minister did eventually touch on this in his press conference, the capacity at a local level to deliver significant volumes of tests in specific outbreak circumstances. So I think the result of today's meeting is a significant net increase in the number of free tests that are available. And we would hope once supply is less of a concern, so in several weeks' time, hopefully we are through the peak of this particular Omicron wave, that some of the pressure on testing will ease. But the bulk of tests will be free and they'll be delivered at state and territory testing centres. In the ACT context, that's nearly 750,000 tests already, and 1 in 6 Canberrans have had a free test in the last 2 weeks.
Can you just explain, you mentioned that you had a bit of a win in National Cabinet, or the states and territories had a win. What exactly was the nature of that win?
Well, I think shifting the Commonwealth to a position of providing more free tests to more people outside of the immediate public health response. So addressing one of the issues that has legitimately been raised, and that is availability of rapid antigen tests for low-income earners. It's a start. I recognise it's not the total answer, and the journey and unpredictability of this pandemic, I think, will mean we'll need to revisit this issue. So the other important caveat was that flexibility under the national partnership, so a jointly funded Commonwealth and state and territory arrangement, to be able to provide more free tests in a wider range of settings. Now, that's going to vary across the country in terms of rural and remote communities, in inner cities potentially, in higher density social housing circumstances. There will be a range of areas where, as a result of today, more free tests will be available. Now, I understand for those who want universal free tests, this is not the complete answer, but it is progress. And I think the important point in any public health context, if you need a test, whether you've got symptoms or you're a close contact, you'll continue to get a free test at a state and territory clinic, and now more people will have more access to more free tests as a result of today. But we can really only work within the framework that, that the Prime Minister sets within National Cabinet. So
are you concerned, though? A lot of testing obligations have been sort of ditched and dumped to try to maximise the access of people who are symptomatic and are close contacts. Are you concerned that that is nonetheless opening up the system to more risks? For example, a lot of workers who will not be tested who will have been tested in the past?
I think there are more risks. It's again a situation that we faced before in the pandemic where there are no perfect outcomes. You're asked to choose essentially between a range of least worst options. What we do know is that we need to triage, and we do need to get quick testing for those for whom a quick test that identifies that they've got COVID can lead to quick and appropriate treatment that will reduce the severity of illness. And so that is very important. And health systems always have to triage. The sheer volume of cases means we have to do that more.
Andrew Barr, thanks so much for your time tonight.
Thanks, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.